So for today's lecture, we're going to be talking about leukocytes. Leukocytes are also known as white blood cells, and you're going to see throughout the lecture that I abbreviate white blood cells as WBCs to save a little time. So white blood cells are the only formed element that is considered a true cell, and that's because it's the only formed element that has a nucleus. And in order for you to be a true cell, you must have in order for you to be considered a true eukaryotic cell, you have to have a nucleus. So white blood cells are critical to our defense system, and that's because they fight off all the bad stuff. They fight us, they protect us from bacteria, they fight off viruses, they destroy parasites, they alert our bodies to toxins and try to take out toxins, and they even check us for tumor cells, cancerous cells throughout the day, throughout the hour, and make sure that they take care of any cell that might just be misbehaving. So the way that a white blood cell goes from point A to point B, because if you cut your foot, we need to get your white blood cells down to your foot to help take care of any bacteria that may have come in through that cut. So the way that our white blood cells do that is through a process known as diapedesis. Diapedesis is where white blood cells can literally just slip in and out of the capillaries, and they can go to the area where there is some damage or there's some type of infection that needs to be taken care of. And they do that by following a chemical signal that's put out by our body whenever there's been a breach. When our white blood cells are mobilized, they speed up white blood cell production because our body automatically assumes that we're going to need a lot more to fight this fight. So what happens is we begin to produce more white blood cells to go out and to attack whatever it is that's come into our body, whether it be a virus that we've taken in, whether it be bacteria that's come in through a cut. When your white blood cell count gets over 11,000 cells per milliliter, we call that leukocytosis, and that's an indicator that you have an infection of some sort and something needs to be done to treat that. So leukocytes is just an umbrella term for white blood cells. And we're going to see throughout this lecture that there are a lot of different types of leukocytes. But leukocytes in general, they're grouped into two main categories. We have granulocytes, which are given their name because they're cells that have these little bitty granules around them. And then we have agranulocytes, which means without granules. And so you don't see those little granules on them. Now, the granulocytes, when you look at them under the microscope, you see the little granules, but you also notice that they're spherical in shape. They look like a ball. And these are all phagocytes, which means they go up to whatever the intruder is, and they take it out by eating it. They ingest it, take it in, digest it with their own digestive enzymes, and save the cell from whatever, bad predator may have been out there. So let's go through the different types of granulocytes that we see. So these are all leukocytes, and these leukocytes are granulocytes. And under granulocytes, we would find neutrophils. Neutrophils are the most numerous of all the white blood cells. So if you're looking at a sample of white blood cells, about half of that population of cells, white blood cells, would be neutrophils. And they're chemically attracted to inflammation. So if something comes in, causes inflammation, the neutrophils go to it to try to take out what may be the problem. Their big job is they take out bacteria. They find bacteria, they phagocytize it or ingest it, and they get rid of it. So anytime we have a bacterial infection like streptococcus or staphylococcus, our neutrophils go into much higher numbers so that they can slay that bacteria. Hence the name they're given, bacteria slayers. They will also take out fungi for us as well. So if we have a fungal infection, neutrophils are on the case to take care of it for us. So a neutrophil is a form of a leukocyte that falls under the category of granulocytes. The next granulocyte is known as eosinophils. Eosinophils are white blood cells that have digestive enzymes on the inside of the cell, and they lead the attack against parasites, specifically parasitic worms. So whenever we breathe in or take in through eating parasitic worms, these eosinophils go in and attack them and kill them. So we tend to find eosinophils in a lot of areas where we have mucosa, like intestinal mucosa or respiratory mucosa, where parasitic worms may enter. So that's where they tend to hang out. Also, just a little fun fact, they have found that individuals who have asthma, they also tend to have a higher number of eosinophils as well. Basophils are the rarest of the white blood cells, meaning we just don't have a whole lot of them. Now, basophils tend to give us a little trouble because they contain histamines. Histamines are a chemical that are made by the white blood cells that cause us to have a reaction where our blood vessels will get wider or dilate. So that's why it's called a vasodilator. And that in turn attracts other white blood cells that lead to things like itchy and watery eyes or sneezing, coughing, things like that. So those of us who are very sensitive to histamines, we may take something like an antihistamine known as Benadryl to help us during times of the year where our basophils may be acting up. So these three are all granulocytes. Now, agranulocytes, remember, they're lacking those granules. So when you look at them under the microscope, they just look like this nice, smooth little cell. Now, there are two types of agranulocytes, and these are all leukocytes. They're just special kinds of leukocytes. The first one is known as a lymphocyte. The lymphocyte is the second most numerous leukocyte, right under neutrophils. We find large amounts of these in our body, but there's not a lot of them found in our blood. Instead, lymphocytes hang out in lymph nodes or other lymphoid tissue like the spleen. Now, we have two types of lymphocytes. We have T lymphocytes, and these are ones that we call T cells, and they go and find cells that have been infected by a virus, and they destroy that cell. They also are able to find cells who are cancerous. They're not behaving like they're supposed to. They're not going through the cell cycle as they're supposed to. So they notice that, and they attack them, and they will destroy them as well. Now, B lymphocytes are known as B cells, and these are plasma cells. They're just hanging around out into the blood, or out in the blood, and they produce antibodies that release in the blood. A lot of people refer to B cells as kind of like the beat cops that just walk the sidewalks looking for trouble and taking care of things that could be potentially dangerous to the cell. Now, monocytes are the largest, not in number, but in size. They're really big cells, and they're phagocytic as well, and they get, their numbers go up whenever they become active. They help defend against viruses, and they also help with parasites as well. So we have leukocytes, and then under the leukocytes, we have the granulocytes, which are going to be our neutrophils, our basophils, and our eosinophils. Then we have our agranulocytes, which are going to be lymphocytes and monocytes. Now, if I were to ask you on the test to tell me the order that you would find them from most numerous to least numerous, a good little trick is called, or to remember, is never let monkeys eat bananas. Never would be neutrophils because they're the most numerous. Let would be our lymphocytes because they're the second. Monkeys would be monocytes. Eat would be eosinophils. And then bananas would be basophils because they're the ones that are in the fewest. So let's talk about a few disorders that can affect the leukocytes. So these are going to be leukocytic homeostatic imbalances. Let's talk about leukemia. So leukemia is a pretty common cancer in that we hear about it quite a lot. But when we talk about leukemia, there's a lot of different kinds of leukemias. So let's just talk about it in general. So this is a group of cancerous conditions, and without treatment, all leukemias are fatal. But leukemia, fortunately, is one that we can treat pretty well. So what happens is your body begins to produce lots of white blood cells that are immature, and it shoves them out into the bloodstream. Well, what happens is your bone marrow and your bloodstream becomes completely and totally occupied by these immature cancerous leukocytes that are just rapidly being produced. So all of our good cells begin to be crowded out. So you may develop anemia because your red blood cells are in smaller numbers. You may notice that bleeding disorders occur, like bruising and things like that, because your platelets are going to be reduced as well. So it just floods the bloodstream and floods your bone marrow with these immature, non-functional white blood cells. When an individual is diagnosed with leukemia, some of the symptoms that will have led them to the doctor is they'll have an unexplained fever. Typically, they lose a lot of weight with no explanation. But a big one is bone pain, because our bone marrow is where you're going to find all of these rapidly being produced white blood cells, and it leads to the bones kind of hurting. Most individuals that I know that have had leukemia or had a family member who had leukemia, they complained about their legs hurting really badly. Now, for individuals who have leukemia, the most common cause of death for those who are not able to fight it off, it seems to be internal bleeding, and in some cases infection, because your white blood cells aren't fighting off like they're supposed to. In order to treat leukemia, individuals go through radiation, where they try to radiate their bone marrow, and then they do anti-leukemic drugs, which is basically like chemotherapy. Chemotherapy is a drug cocktail that targets rapidly producing cells, and it stops them, kills them, and that's what cancer cells are. They're just rapidly producing cells. Bone marrow transplants are used in selected patients who meet the criteria, which could lead to full remission. The other homeostatic imbalance that I want to discuss is known as mononucleosis. You know it as just mono. We used to call it back in the day the kissing disease, and it was because mono was passed by kissing, but it's not just kissing. You can get it from drinking after a friend, or talking on a phone that somebody else was talking on that had mono, or laying your head down on your desk behind somebody who had mono and laid their head down on their desk. And so basically it's just the exchange of this virus, typically respiratory or through saliva. It's highly contagious in children and in young adults. And the virus that causes mononucleosis is known as the Epstein-Barr virus. The bad news is when you get mono, there is no cure. You just have to let it run its course. And your body does a lot of weird things trying to fight it off. One thing is you usually run a fever trying to fight off this virus. You typically, because you're running a fever, you feel tired and achy. It does cause you to have like a sore throat. And basically, you just feel terrible for a while. Mono can run its course in anywhere between a week to a month. And also during this time, because you're producing more white blood cells to fight off the virus, your spleen typically enlarges. So individuals who have mono are not allowed to play in contact sports when they have mono, because it could cause a splenic rupture. So that's going to finish us up for white blood cells. If you have any questions, please feel free to email me.